Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Recently, I started my series on anterior triangle lectures. I've already covered the introduction to anterior triangle, covered the carotid triangle, and today I'm going to talk about the digastric triangle and its contents. Okay, the links for earlier lectures are available. You can use those to study both the topics. Let's begin today's class with a request. I want all of you to sit with color pencils and coloring drawing sheets or any drawing implement, a digital drawing implement. But when I ask you to draw, I expect you to draw. Okay, that's not because I get some pleasure out of it, but because it really helps you. It brings about better understanding and better recall. I have recently written an article on this in LinkedIn. So if you want, you can check that out to understand how drawing really helps. But yes, I am requesting you, please draw when I ask you to draw. So digastric triangle, students. As usual, we begin trying to understand where we are. So let's solve this MCQ. Following gland is found in the digastric triangle. Superficial part of submandibular, deep part of submandibular, sublingual, pituitary. Some of you have an idea, some of you probably are not so sure. There are other questions asked in the digastric triangle, such as write a note on digastric triangle, give the contents of digastric triangle, and so on. See, to be able to have a general idea is one thing, but to be able to exactly click on the right option, you have to have knowledge about the topic, which is what we are going to acquire today. Okay, so let's come to the anterior triangle. As you know, anterior triangle is bound in the midline by midline structures, posteriorly by sternocleidomastoid, and superiorly by lower border of mandible and an line joining the angle of mandible to the mastoid process. We know these two are our anterior triangles, right? So, in a dissected body, you are seeing the anterior triangle as here. Remove the body, draw these boundaries now. Draw your anterior border, draw your posterior border, draw your superior border. And then divide your anterior triangle with the help of hyoid bone, posterior and anterior bellies of digastric, and with the help of superior belly of omohyoid. I hope all of you are drawing students. So you're dividing that one triangle into 3.5 triangles. Okay, so now out of the 3.5 triangle, we want to pay attention to this triangle, which is the digastric triangle. Are you understanding where we are? Anterior triangle, just below the mandible, your digastric triangle. That's where I want your attention to come to that. This triangle is bound anteriorly by the anterior belly of digastric, posteriorly by the posterior belly of digastric, and superiorly by the mandible and imaginary line going to mastoid. This is the triangle I want you to think of today. Okay, right. So, as I say, whenever you are studying a triangle, study it under the following headings: boundaries, roof, floor, contents, applied anatomy. Simple. Okay, so let's begin. What are the boundaries of posterior of digastric triangle? The boundaries are as follows. Anterior boundary. Yes, tell me. Yes, anterior boundary formed by anterior belly of digastric. Posterior boundary formed by two muscles. Posterior belly of digastric, yes. And who is the best friend of posterior belly of digastric? Stylohyoid. So both of them together form the posterior boundary. And superior boundary is formed by the base of mandible and an imaginary line going from base of mandible to the mastoid process. Have you got it? So these are the three boundaries. Let's quickly revise. Okay. So anterior boundary, anterior belly of digastric. Posterior boundary, two muscles. Posterior belly of digastric, best friend, stylohyoid. Superior boundary, lower border of mandible, an imaginary line going from mandible to the mastoid process. I've got my boundaries in place. This here is my digastric triangle. Okay. So now I study it, boundaries done. Roof. Roof as usual, always it is skin, superficial fascia, deep fascia. But what specifically in superficial fascia you need to know. So the superficial fascia contains fat, contains a muscle called platysma, and contains cutaneous nerves, specifically cervical branch of facial coming from parotid gland. In investing layer of deep cervical fascia also there is something to be noted. This investing layer of deep cervical fascia splits to enclose your submandibular gland. It would be good if you were smart enough to mention this. So roof is done. So that means what is left now? Floor. Observe this image. From anterior to posterior, one below the other, the floor is formed by mylohyoid, posterior belly of digastric, and middle constrictor. Can you use your hands, students? Mylohyoid. See, mylohyoid is to be done like this because it forms the floor of your mouth. Mylohyoid, hypoglossus, constrictor. Do this again. Mylohyoid, hypoglossus, middle constrictor from anterior to posterior. Mylohyoid, hypoglossus and middle constrictor. Okay, from anterior to posterior. So that is the flow. Let's now talk about the contents. Okay. Oh my God. There is so much of material. Which student is going to be able to remember all this? I am not that student. I am not sure if you are either. So how do we remember all this, students? Let's use some kind of mind imagery. Okay. So first understand that the digastric triangle is divided by stylomandibular ligament. Here is your stylomandibular ligament going from styloid process to the angle of mandible, dividing your triangle into an anterior part and a posterior part. Okay. One triangle has been divided into two smaller triangles. Fine. So this is posterior belly of digastric, anterior belly of digastric and superior border. This is divided with the help of this stylomandibular ligament into an anterior part and a posterior part. I hope you are able to relate to this. This is a very important part of the class. If you are able to relate to this, everything else will go fast. Okay. So now we're going to talk about only that small little anterior triangle that you saw. Okay. Which consists of again so many structures. Alright. Let's use images to put these structures in our brain. You'll be surprised at how beautifully you will learn. Submandibular gland, submandibular lymph nodes. Let's take a look at them. Okay. So now here we are seeing that this is a mandible. Okay. That's the tooth. A part of the mandible has been removed to give you better vision. You're seeing that the anterior part contains superficial part of submandibular gland. On a deeper aspect, there is a deep part of submandibular gland separated from each other by mylohyoid muscle. Imagine this is my submandibular gland, superficial part, deep part. In between them is my posterior border of the mylohyoid muscle. Okay. So what will you see from outside? You will only see the superficial part of submandibular gland. Where is the deep part? Deep to the mylohyoid, stuck between the mylohyoid and the hypoglossus. Look at the image to understand. The deep part of the gland is stuck between the mylohyoid and the deeply placed hypoglossus muscle. As on now, just remember, superficial part of submandibular gland occupies most of the anterior part of the digastric triangle. Right. So now next thing we consider are the submandibular lymph nodes. First there is a gland. You can see it here. On its surface are lymph nodes called submandibular lymph nodes. Okay. These are enclosed within the same investing layer of deep cervical fascia that splits to enclose your submandibular gland. Okay. So they are deep to the investing layer of deep cervical fascia. What do they drain? See. Look at the image and understand that there are lines here. These lines indicate what it drains. So it drains part of lateral wall of nose, part of upper lip, part the submental lymph nodes and so on. All these are structures drained by the submandibular lymph nodes. Okay. So understand that these lymph nodes have a very large area of drainage and this is all very active area. You have nasal infections, you have tooth infections, everything is going to come down to the submandibular lymph nodes. So what is important about it? Just understand that a cancer in this region will also come to submandibular lymph nodes. And because it's enclosed within the same investing layer of deep cervical fascia and the close proximity to submandibular gland, when you are operating, you might have to remove the gland along with the submandibular lymph nodes in block dissection of the neck. Understand what I am trying to say. Okay, you might have to remove the gland with the lymph nodes. Okay, one of these lymph nodes lies very close to facial artery. Put that in your brain. We will be discussing it subsequently. Right. The next structure I want to talk about is the facial vein, which lies just superficial to the submandibular gland. This vein is accompanied by the cervical branch of facial nerve. Let's talk about the facial artery now, which is the next content. If you recall, facial artery is a branch of external carotid artery given off in the carotid triangle. So it travels upwards from the carotid to enter digastric triangle, and look at it, it forms an S-shaped loop around the submandibular gland. Look at the image to understand. Initially, it is deep to submandibular, winds around it, lies superficial to submandibular, and finally winds around your mandible to come onto your face and supply the face. Okay, so that is the facial artery. At the lower border of mandible, it gives rise to the submental artery. So just remember that as it's winding around the mandible, okay, it is related to that one lymph node, okay, and also related to the marginal mandibular nerve branch of facial nerve. How does it matter? Isn't it? You're wondering, how does it matter? Just imagine that you're operating on that submandibular lymph node for some reason, either it's infected or whatever. If you don't know the anatomy that there's a marginal mandibular nerve so close by, you're likely to damage it. And what will the patient suffer from? Paralysis of muscles of the lower limb. So you have to be careful, and these anatomical small relations are very crucial when you actually begin to operate on these cases. Right. So let's now talk about one more content, the hypoglossal nerve. As you can see, this is the anterior belly of digastric, posterior belly of digastric, mylohyoid and hypoglossal. Observe, and that's the loop of lingual. Remember, loop and hypoglossal, always together. Okay, so here you can see the beautiful loop and you can see the hypoglossal nerve traveling over it. But as they move forward, which muscle comes in between them? The hypoglossal. The hypoglossal goes superficial to it, the lingual goes deep to it. The hypoglossal later travels forward to supply the muscles of tongue. Right. The hypoglossal, can you see those two small blue lines here? These are venae comitans that accompany the hypoglossal nerve. Finally, in the anterior-most part of digastric triangle, just superficial to the mylohyoid, are mylohyoid nerve and vessels. Just remember, mylohyoid nerve is a branch of inferior alveolar branch of mandibular nerve. These are motor branches to the mylohyoid and anterior belly of digastric. Now you are wondering, why is madam giving us this information? Because this is indicative of the fact that anterior belly of digastric and mylohyoid are developing from the first arch. You remember posterior belly is supplied by facial nerve, and we know is developing from the second arch. So nerve supply often gives you a direction about their development. That's why the discussion. Right. So let's now come to revision. We have an anterior part of we discussed how the stylomandibular ligament divided your triangle into an anterior part and a posterior part. Then we started a discussion on an anterior part of digastric triangle. Then we used a lot of images to understand. For example, this first image showed us how the digastric triangle contained superficial part of submandibular gland. It also contains, what is this? Yes, submandibular lymph nodes. What is this? Submandibular, the facial vein covering the submandibular lymph nodes and gland. Here you can see the facial nerve having an S-shaped loop as it crosses the submandibular gland and then passes below the mandible. Here it gives rise to another artery, submental artery. Come to the last diagram. you can see the beautiful hypoglossal nerve, and in the anterior region, you can see mylohyoid nerves and vessels. Moral of the story: every time you need not read the detailed theory. Sometimes images can help you to build the picture in your mind. Use your images well. You needn't draw them every time. These are not all that easy to draw. But an image will help you to build the numerical number of contents that you were required to talk about. So you can superficial part of the submandibular gland, submandibular lymph nodes, facial vein, facial artery, submental artery, hypoglossal nerve, mylohyoid nerves and vessels. Just one sheet of images and your job is done. Okay? Right. So let's solve this MCQ now. The following gland is found in the digastric triangle. I am not going to answer this. If you don't know this at the end of the last 10 minutes of class, then there's no point in taking the rest of the class, isn't it? Hopefully you already know the answer. Right. So let's come back to the image that we had built. Anterior part done. Let's go to the posterior part. In the posterior part, all structures are arranged as superficial, intermediate and deep. So what do you find immediately? Then what do you find deep to that? And what do you find deep to that? So let's begin again using images. The superficial contents are a parotid gland. And can you see that deep to the parotid gland is the external carotid artery here? So these are the two superficial contents of the posterior part. Now, intermediate. This consists of structures that pass between the superficial, between the external carotid artery and the internal carotid artery. Okay, so let's take this is a better image. That's the internal carotid artery, that's the external carotid artery. And if you look carefully, a number of structures are passing in between them. To be precise, the structure that is passing is the styloid process. Okay, from the styloid process, two muscles are passing forward. Styloglossus to your tongue, stylopharyngeus. Okay, stylopharyngeus is always accompanied by its nerve. Which one? Glossopharyngeal. Also passing through this gap is the pharyngeal branch of vagus nerve. So the structures passing between external carotid and internal carotid are styloid process, two muscles from it, styloglossus, stylopharyngeus, the nerve that accompanies stylopharyngeus, that is glossopharyngeal nerve, and finally the pharyngeal branch of vagus nerve. All this and the parotid gland itself, which encloses the external carotid artery, are structures that pass between ECA and ICA, or internal carotid artery and external carotid artery. Finally, what are the deepest layers? Superficial, intermediate is done. Now, what are the... Okay, let's use this quickly, then we'll go to that point. Create a simple image to trigger your memory. That's your internal, that's your external carotid artery. In between them, that's your styloid process, giving attachment to two muscles, styloglossus and stylopharyngeus. Stylopharyngeus always accompanied by its nerve, glossopharyngeal. And also the pharyngeal branch of vagus. All this enclosed within the external the parotid gland. So sometimes some simple images help you to understand better. Maybe if this helps you, please use it. Right. Deep structures you can see are internal jugular vein, vagus nerve and internal carotid artery enclosed within the carotid sheath. So let's revise the posterior part. The superficial structures were two, parotid gland and external jugular vein. The intermediate structures were internal and external carotid artery and structures in between, that is styloid process, styloglossus, stylopharyngeus. Stylopharyngeus accompanied by glossopharyngeal, pharyngeal branch of vagus and the parotid gland. The deep structures were structures enclosed within carotid sheath close to the norma basalis, internal jugular vein, vagus nerve and internal carotid artery. So with this, we have finished the anterior part, posterior part. Anterior part consisted of 7 structures, 1 submandibular gland, superficial part, 2 the submandibular lymph nodes, 3 facial vein, 4 facial artery, 5 submental branch of facial artery, 6 hypoglossal nerve and 7 mylohyoid nerve and vessels. Once you have mind image Okay, it's very easy to answer these questions. Posterior part, superficial, parotid and external carotid artery. Intermediate, structures between external and internal carotid artery. And deep, structures within the carotid sheath near the base of skull. So this completes the digastric triangle and its various contents. Now let's revise by asking ourselves, how did we begin? We brought ourselves into the anterior triangle. Then we divided the triangle to understand where is the digastric triangle in the anterior triangle. Then we talked about the digastric triangle as boundaries, roof, floor. Remember the floor, we did an exercise, mylohyoid, hypoglossus, middle constrictor. Simple things create physical memory. Okay. Then we talked about the contents as anterior part 7 contents, posterior part superficial, intermediate and deep. And of course, we also added a bit of applied anatomy to it. So let's see if you can solve these MCQs now. Following structures passes between internal and external carotid artery. I think it's a very simple answer. You should be able to solve this. Okay. Let's go to the next question. The floor of digastric triangle is formed by the following muscle. See, remember the exercise, mylohyoid, hypoglossus, middle constrictor. Obviously, answer is mylohyoid. Right. So we come to the end of another class on triangles of the neck. Okay. So ethics is knowing the difference between what you have the right to do and what is right to do. Please remember this, students. In this world where doctors are believed to be unethical by many, okay, our knowledge of what we can do and what we should do should be very clear. Okay. So thank you. I enjoy taking this class with all of you. I hope to look forward to meeting you across the screen in some other lecture. Okay, students.